Hello YouTube. I wanted to start with a body shot. So good morning. Today's the 17th, May 17th, 2012. I I wanted to start with a body shot, and not even a full body shot, but because on the 15th, which was Tuesday, I went for my first consult with the bariatric surgeon, and I was, of course, nervous beforehand. It's like, this is the start. This is it. And so we had a very long consultation and discussed me personally, all the problems that I'm having, and which surgery is best for me. So we we discussed all the options, and of course, I was going for the sleeve, but he suggested the bypass. My son is saying hi. He suggested the bypass, and my whole idea of not wanting the bypass was that for malabsorption issues, I'm already vitamin deficient in D and B12. I have an iron deficiency because of, I'm usually anemic because of thalassemia, which is a blood disease that I have. And his whole thing was like, well, you're also really borderline diabetic. And because you borderline diabetic, you will most likely need a transfusion anyway. So the not because you but because Bradley, my son is not. I haven't been able to tape this thing in 2 days. I think he discovered the camera. So yeah, because you're diabetic, because you're close to being diabetic, I'm like 0.5. So he's like the gastric bypass would basically eliminate that issue right away. Yeah. So I sort of have like a decision to make. My whole idea was like, oh, I don't want to do the gastric bypass because of malabsorption issues. But then he's thinking that maybe being borderline diabetic, or really like half a point, it's like is a more of a problem than the thalassemia, because I think he's saying with the sleeve you may have to have the iron transfusion anyway. So I've been thinking about what to do, and of course I really want to have my surgery during the summer. When I went to see him, so there's a lot of things that you have to do, and I'm sure a lot of you know there's a big step. It's not a 1, 2, 3 process. You get a surgery date, and my insurance company was very ambiguous as to like what needs to be done, especially with the pre diet. It's like you have to. Just says you must follow a supervised nutritionist program. It didn't say for how long. The doctor first recommended 6 months, but 6 months will take me smack dab in the middle of the school year. I'm a school secretary, so that wouldn't work for me. I really need to get do something during the summertime where it's like I'm working, but it's less. It's not, or the professors are not there. So with that being said, I'm trying to shoot for July, end of July, early August, early August as the latest. So the doctor's office does have a 13-week supervised nutrition program. And again, the insurance company did not say for how long. So, and I've since been to a nutritionist before in March, and I've basically been following my doctor's diet since then. And we're in the middle of May. So, but I guess you need it documented. So, and I have not been documenting everything. Well, I mean, it's not doctor supervised. But But in either case, now it's definitely going to be, and so that's a good thing. And again, it was lots of homework. I have to see a psychologist. I have to see a nutritionist. I have to get several tests. I also have to see a cardiologist. Now, I also had to see a bunch of other doctors, but because of the issues I've been having, I've already seen them. I've already seen a gastrologist. I've already seen a pulmonary specialist. So a lot of my steps have already been done. As far as seeing what doctors you need to see to get a check to say, okay, you're fine for surgery. The only person I really have to see doctor-wise, medical doctor-wise, is the cardiologist, which I have an appointment with today. And then the second person, of course, is the psychologist, which I'm making an appointment with. So hopefully I can get everything done. I'm a boom boom person, you know. When I'm doing something, my mind's in it. I'm go 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 go. And that's a good part of my personality, and then that could be bad too, because I don't want to rush, you know. But I think taking months to do something, again, the decision would be gastric bypass or sleeve. Doctor saying because of your pre-diabetic condition, the gastric bypass would be the best. My whole discussion was like, well, with the gastric bypass, you may have malabsorption issues that you wouldn't have with the sleeve. But he's saying, well, you would have it anyway. And I've actually discussed this with my husband yesterday, and he tended to agree. He's like, well, you know, this doctor, if he's a specialist in it, he would know best. And he's also saying that you since you haven't been diabetic before, you don't know what problems you would be faced with, and that's why you think you're more worried about the thalassemia and the anemic, because you've been dealing with that, so you know what that's like. And I think he's right, because I do know what the anemia and what I face with the thalassemia. I'm more ready to like deal with that than diabetes, because I don't know. But I'm close, and I think one of the reasons I've been feeling so bad is because I'm so close to being diabetic. So with that said, I'm still trying to make up my mind. I actually signed both papers for the sleeve and the bypass. And so my thing would be to say, my joke at the doctor's office was like, you know, the doctor's not gonna know if you should connect, disconnect, or cut. So my joke wasn't right. But anyway, as you can see, I've been trying to do this video for 2 days, and my son would not let me. And so, and I think this is gonna be the end of it, right, boo boo? Say hi, say bye, YouTube. Bye, YouTube.